Dr. Jonathan Forteo completed his residency education at Yale.
Here's a list of reported side effects of Zircon.
What was that about?
I think we need to be honest about any side effects in our medications.
Don't forget who butters your bread.
Dr. Forteo, I recognized you from your picture.
You need an appointment.
I read that you could see depression in the brain using a brain scan.
I'm sorry, I have a full clinic today. I need to go.
Look, your patients could be in danger. I've spoken to a lot of families, and they're all going through the same thing I am. My son, Jacob, I love you.
Love you too, Mom.
He was captain of the wrestling team. He was a good kid. He was happy. I didn't even know anything was wrong.
Was he on any medication?
Well, just for acne.
What was it called?
Carinoderm.
Dr. Forteo, we've got over 100 victims of carinoderm. Amanda Bellaconda's one of our clients. She insists that these brain scans of yours might be the only thing that can stop these bastards.
So she's suing the drug company.
I can't get involved in a court case. It's a conflict of interest.
Why do you want to do a study of Carinoderm? It's a great drug.
People have the right to know what they're getting into.
Jacob needs somebody to fight for him.
You don't have to say yes to everything that people ask of you.
Kids are dying out there.
We are going to pass $1 billion in sales this year. Our only liability is Jack Forteo.
So today on Moral Medicine, we're joined by Dr. Doug Bremner, professor of psychiatry and radiology at Emory University, and one of the first researchers to seriously investigate the psychiatric risks of Accutane. His landmark brain imaging study revealed changes in the orbitofrontal cortex of patients taking Accutane, opening the door to scientific recognition of what so many people had already been experiencing: depression, suicidality, and long-term symptoms that many now identify as Post-Accutane Syndrome. Beyond the lab, Dr. Bremner has written extensively about the hidden risks of Accutane, including his book, The Goose That Laid the Golden Egg, which examines not only the science, but also the systemic forces that kept these dangers in the shadows. The book has even been made into a movie, further amplifying his message. We'll be talking about his research, the pushback he's faced, and how Accutane's story parallels other post-drug syndromes like PFS and PSSD that we cover here on Moral Medicine. Could you start by telling us a little bit about your background, your medical training, your work at Emory, and what led you into psychiatry and brain imaging?
So I'm a professor of psychiatry and radiology at Emory University in Atlanta, Georgia. And I started out my career at Yale. I was an assistant professor and doing brain imaging studies in patients with depression. We were able to experimentally make people depressed and look at what happened in the brain. And we found a decrease in function in a brain area called the orbitofrontal cortex. And so we concluded from that this change in function in this brain area is the actual, correlate of depressed mood. And based on that, I got involved in doing research on patients with acne who were looking to get treated for their acne. And so we did a baseline brain scan on them, and then we gave them either Accutane or antibiotic, which is another treatment for acne, for 3 months, and then we scanned them again. And to my surprise, we found that the people treated with Accutane had a 21% decrease in function of the same brain area, the orbitofrontal cortex, that we had seen in depressed people, whereas the antibiotic patients didn't have any change in their brain at all. And based on that, we said, well, this drug, which is a treatment for acne, can affect your brain function, which made sense because we know it goes into the brain. We know it has effects on neurotransmitters in the brain. And animal studies showed that it can do things like inhibit nerve growth in a brain area called the hippocampus, for instance, which seems to be a common thread with a lot of these other medications like finasteride that have neuropsychiatric and sexual side effects.
Yeah, absolutely. And bear with me here. I think you already answered this. What specifically got you into the Accutane realm?
So I got involved in Accutane research because a family member of a parent of a suicide victim was interested in having research done to see what was underlying this rash of suicides in teenagers that were treated with this medication. And so they donated money to do research, and then that led us to do these PET scans of the brain, this positron emission tomography of the brain, to look at and see if there's changes in the brain function, which we did. And then based on that, I got involved in following that. I reviewed the literature more, and reviewed all the literature about what had been published, both in animal studies on the effects of this drug on the brain, and case reports, clinical reports, et cetera, in patients treated with the drug. So I started out, in the Accutane field, and then I proposed to, I was writing a book about psychological trauma, which has been sort of my main field, and then I proposed to my agent to write about, at that time, the 10 deadly drugs, I would call them. There's a guy at the FDA named David Graham who was testifying about these medications on the market that were unsafe, and one of them was Accutane. And so then they said, well, why don't you just expand it into all different medications? So I kind of took the viewpoint where I went through each medication, and then I read the studies that that had been published. And what as what happens is that the advertising, the pharmaceutical advertising, tends to bias the information in their favor. And then the other component would be I call it the medical pharmaceutical academic complex, where you got academics who are kind of like on their sides, and then the ones that are writing about the side effects or the things that they don't like, they tend to single out and try and isolate them and stuff. But so I kind of expanded into different areas like statins, et cetera. And then and one of the things I did is I went and read on, at the time there was like a website called medications.com, and I would read the patient writing forums, what they're writing about, and what were some of the complaints that were coming up. And at the time, finasteride was not on the radar, although now obviously it is on the radar. With and it's kind of grouped up there with Accutane and with Singulair, which is an asthma medication. And so I've sort of been, kind of contacted through the internet from some of these sort of patient advocacy groups are kind of formulating. Right now for Accutane, it's more in Europe. And the United Kingdom, and then in Australia, and then some of the main advocates for Singulair are in Australia. So that's sort of my background. So I've sort of heard about finasteride in a peripheral way, but it's not my main area. But I mean, when just kind of looking at it quickly, it's sort of the same story where you have a medication for a specific condition, and then it also goes into the brain. And so once it goes into the brain, it's going to do things in the brain probably. And then once you get into the brain, I mean, who knows what's going on there? Like the Paul Smith was the main attorney for some of the litigation related to Prozac and the Westbecker case, which was a case of a guy who committed homicide when he was on Prozac. And he said, you start making serotonin go up and down, you have no idea what's going on in there.
Absolutely.
So that's pretty much the story, I think.
It's kind of all the same thing with all these different medications, whether it's Accutane or finasteride or SSRIs. Or finasteride in particular it's a 5-AR inhibitor, blocks the conversion of testosterone to dihydrotestosterone, which is typically attributed to hair loss. And so it's just become so mainstream over the past probably 5 to 10 years since these telehealth companies have come out. And I talk to guys all the time who are getting damaged by this stuff, not just dealing with neurological issues, but physical issues as well, sexual issues, muscle loss, skin issues, voice changes, lipoatrophy. I mean, the list just goes on. It's unbelievable. So,
I'm hoping it has a lot of sexual side effects as well, as you probably have heard.
Yeah, absolutely. I did actually see the trailer for the Goose that laid the golden egg recently, and I'm looking forward to seeing that. When is that supposed to come out, or is it already out?
Well, it's completed, but we're just going through the film festival circuit thing now. So we're applying to film festivals, and the idea is if you can get into the festival that distributors go to, you can get distribution that way.
Yeah, absolutely. I'm looking forward to watching it.
We just finished it, so thanks. The trailer is only 2 weeks old, and
Yeah.
But a lot of these Accutane advocacy groups are cluing into it and sort of doing their own publicizing of it and stuff. There's Facebook groups that for Accutane, there's a Facebook group that has 18,000 members.
Mm-hmm.
And,
I'm actually part of a. I'm sorry to cut you off. Go ahead.
No, that's all right. Like there was someone that was, one of the family members. They said, "Well, there's this family member who actually is cousins with the vice president of Roche."
Oh wow!
And so she showed me this letter just recently where he was saying, all their propaganda about why there's no association with depression. And I said, that's just all propaganda. I mean, there's 18,000 people on a Facebook group that would, but at this point, I don't really debate them anymore because it's just it's like a waste of time. I mean, it's like trying to talk to somebody about whether or not the earth is flat or not. It's like they become like, that's another thing is that I wrote this book with my sister called Justice in the Age of Judgment about how people kind of formulate opinions about crime cases. And once people get fixated on a belief, it's very hard to change their mind.
What drew you towards investigating the links between medications and mental health? And was there a moment when you realized this would be an important focus for your research?
Well, so I started out, I'm a psychiatrist and nuclear medicine physician. So I started out, I was doing research at Yale in brain imaging and depression. And so we were able to experimentally induce depression by having people drink this low tryptophan drink, basically, and their serotonin levels would drop acutely. And about half the time, and these are people who've been treated with Prozac and recovered. Mm-hmm. And so about half the time they would get depressed, and we had them in the brain scan and brain camera, and we were able to see a drop in function in a part of the brain called the orbitofrontal cortex. So there was originally there was a guy from Ireland who wanted to donate money for research. And so I was skeptical at the time, but it was like, okay, well, we can do another brain imaging study. And, that's kind of what I do. And so when the results came out that they looked just like the people that became depressed, that was kind of a surprise for me. So that was really the turning point.
That was specifically with Accutane?
Yeah. So we treated people with Accutane for 3 months, and then we compared them to people treated with antibiotics. And, there's like this clear decrease. And not only that, but everyone who got headache had a decrease in brain function. So that was sort of a secondary validation for me, because we already knew that the people that get headache are more likely to get depressed, which makes sense because, something going on in your brain. Obviously, not everybody's going to respond the same way, and it's going to be the same for drugs like finasteride. I mean, not everybody's going to develop depression or sexual side effects, but, some people do. And so, in the ones that did, that did develop headache, they were, that's obviously a marker that there's, something more going on for them in their brain than other people. So then after that, I became, that sort of made me, because of that, I became kind of like the world expert on this drug.
Right.
Kind of like a reluctant expert, I guess you could say. And then there's a multi-district litigation. There's over 100 cases of suicide and depression that were all going towards this one case in New Jersey. Mm-hmm. And the judge excluded me initially, but then that was overturned on appeal. And I didn't learn until just a year ago that they'd actually had a major settlement with Roche. And all these cases, part of the settlement is that they couldn't say that there's a settlement. And also the case in Ireland settled as well. So that's why that story sort of kind of went away. But the other thing is that Roche just did a really good job of kind of spreading their propaganda that there was nothing there, and that's why it's like there hasn't really been a lot of press conference coverage in the U.S. Although in the United Kingdom there has been, and it just keeps popping up. I mean, it's like it just won't go away,
Well, that's the thing. I talk to people all the time who've been damaged by even Accutane. Why isn't the medical system recognizing this officially, post-Accutane syndrome or something like that?
Well, because number one, you start out with the the drug company, and nobody wants to admit that a drug, something they're doing is causing harm, right? So
Sure, of course.
they think that they're helping people, and so if you tell them, well, actually you're making a drug that can cause people to kill themselves, then they don't like that, number one. So you got the pharmaceutical company who has sort of a corporate mindset where they're reinforcing each other's viewpoints that there's nothing there. And then they're also getting, reinforced by, they're making $1 billion a year on the drug. And then they're interacting, they're already have a mechanism set up to interact with the physicians where they're marketing to them, but then they're also, giving them gifts and vacations and this and that.
Yeah.
And lectures, education. So part of the education is kind of downplaying the risks and emphasizing the benefit. And then in the case of Accutane, the dermatologists are making a lot of money, and it's a great drug for acne. It works really well.
Sure.
And so if you were to look at like finasteride, you've got like young men with hair loss,
Yeah.
I mean, it's like you've got this group of people that are really, and the acne patients are people sometimes with cystic acne, although back when I got involved originally, they were giving it to teenagers with small pimples that should never have gotten it in the first place.
Right.
But even then, I've got a 13-year-old who has some pimples, and they're very conscious of their appearance, and so there's a lot of impetus to move towards use of the drug, and
right.
And then and then some of the medical societies are like the American Academy of Dermatology, they're just in denial, and they come up with these kind of position statements that there's no evidence, or they'll say, and a lot of times the logic is wrong, where they'll say like there's been no clinical trial, to prove it, but we can't do a clinical trial with suicide as the outcome. And there's other ways that you can demonstrate causality with the medication, including in the case of Accutane, is the challenge, de-challenge, re-challenge. That alone is proof enough of causality, according to like the textbook of pharmacoepidemiology. But the dermatologists, they're not always real academics. They're kind of like pointing to one review that said there was no association, but if you look at the totality of the evidence, it's indisputable, and like I said, it just keeps coming up. It's not going to go away, and there's a case of psychosis. There's been multiple cases of psychosis, and then some of them has been teenagers that killed like a best friend. Wow. And I said in that case, this is not the first time this happened, and it won't be the last. There will be other homicides in the future, psychotic people that, they kill a friend for no reason other than just they have recurrent homicidal ideation that they can't get rid of.
That's unbelievable. So I guess that's kind of my point, is that we have this objective data. I think you use PET scans to show the brain changes from administering Accutane, if I remember correctly.
Right. Yeah.
We have the data there. So why, how are they legally getting away with not acknowledging this?
Well, another way they get away with it is that, and what happened with the case of Accutane and why I think the publicity died down, is at a certain point the FDA came in and said, Accutane may cause suicide, depression, and psychosis. And then at one point they even said Accutane causes a decrease in orbitofrontal function and inhibits nerve growth in mice in the hippocampus, which finasteride does as well. I don't know if you've come across that.
Yeah. Yep.
So when you see something that's inhibiting nerve growth in the hippocampus, that's like a major red flag. That's like kind of ground zero for the brain correlates of depression. Right. That's one whole theory of depression, is that it's just caused by a decrease in nerve growth in the hippocampus, which is the only part of the brain that can grow new neurons in adulthood. But anyway, so the FDA is saying it inhibits neurogenesis in the hippocampus. So they're basically just listing all the details of the research studies that have been done. Mm-hmm. But even now, like with some of those FDA people retired, and then some of the new FDA people are kind of waffling a little bit, and the retired FDA people are saying, what the hell is going on? They're like waffling on this issue. But there's also a certain level of, I think, arrogance in physicians that especially kind of older physicians that have this attitude like, you should just sort of take my word as the expert, and the patient should not, be trying to figure things out on their own. And I've kind of obviously taken the alternative route, and I've advocated that people should kind of learn for themselves, but that's sort of a different attitude or pathway to take. But It's I think it's sort of, I liken it to the thing like, like if you look at like, I don't know if you follow any true crime at all, but like if you've heard of like the Amanda Knox case, where there's now a series on Hulu about that case that people decided right away that she was guilty, and then they just couldn't change their mind. It's just sort of becomes entrenched.
Yeah.
And there's a lot of psychological reasons why that is, I think, but and then there's what we call confirmation bias, where people, they make up their mind and then they look for things that reinforce what they think. There's a, paper comes out on Accutane saying no association. So then they point to that and that confirms what their belief is without looking at the whole picture.
Yeah. So it's kind of multifactorial there, and you mentioned yourself that you listen to your patients, and a lot of doctors don't do that. That's been my experience with having PFS. Doctors don't want to believe that this medication can cause these types of changes. And so it's like this endless cycle. But again, it's not just with finasteride, it's with Accutane, it's with SSRIs, it's with a lot of different things. You mentioned something too about re-challenge, I think is the word you use. Is that where you get essentially re-exposed to the medication?
Yeah. So like if you take a medication and then you have an outcome like you become depressed or you develop a sexual side effect, that's a temporal association. So that's sort of the first, block to look at is like, was the person not have the problem before? And then after they started, they have the problem. So that's one thing. Right. And then if you go off the drug and the problem goes away and then you go back on the drug again and it comes back, then that's a challenge, de-challenge, re-challenge. And most people that are kind of experts in this drug causality, which are not most of the people commenting, most of the doctors commenting on TikTok or the internet, would say that alone is evidence that there's a causal relationship between the drug and the side effect. And in the case of Accutane, going back to 2020, there are 37 cases reported by the FDA, and that was their conclusion that it could cause depression. So, but there's a dramatic drop, and then they put a black box warning for suicide, depression, and psychosis. They created the iPledge program where everyone has to register. And so then they say, well, the black box warning is there, so no more lawsuits, because there were summary judgments from the judges saying it's already on the label as a black box warning. Yeah. We have the iPledge program, which you have to do a signed consent and register the pharmacist and the doctor and the patient. So they have all these regulations that don't exist for any other drug. So then they said, okay, well, we've done our due diligence and we're done. But that still doesn't account for the fact that, people are going to a dermatologist and they say, well, we have to tell you about this depression thing, but I don't really believe it. So here's the medication and good luck, so. That's
wild. Yeah, that's what it seems like. I mean, that's even with the same story with finasteride. Are you seeing symptoms that go beyond just the psychiatric symptoms? Have you heard of people developing physical symptoms for this as well? You mentioned sexual, but any muscle atrophy or skin changes or anything like that?
Well, for Accutane, it's so you have to kind of think about like what is it actually doing? So the same would be for finasteride. It's a 5-alpha reductase inhibitor, so it's blocking the formation of the DHT. Right. And then you say, well, what can that do in the body? So for Accutane, it's a isomer of the active form of vitamin A. So it'd be like if the molecule looked like that would be the active form of vitamin A, and then this is Accutane. So it's a mirror image. In other words, it's almost the same molecule, but it's so vitamin A is in the form of carrots and things like that, orange vegetables, and you eat it. It's metabolized in the body to the active form. And that we didn't really appreciate it before. We just associated the deficiency with night blindness, but it acts kind of like a neurotransmitter. So it's doing all these things in the body. It's affecting dopamine and norepinephrine levels in the brain, affects neurogenesis, affects gene transcription, et cetera. So we know that Accutane is affecting, has all these neurological effects, but it's also, it dries out the skin. And so any skin tissue that's kind of related to the skin is going to be affected. And so that's your brain, your gut, they all come from the same tissue. It's called ectoderm in development of the embryo. So you start out with the ectoderm, and then that branches out to the brain, the gut, and the skin. So people get problems with joints because the cartilage is sort of related in that same family of cells.
Okay.
So they get joint problems that can become, cartilage damage. It can be permanent. They can get bowel problems like, Crohn's disease or irritable bowel syndrome.
Yep.
And then the pseudotumor cerebri is like an increase in the pressure of the spinal fluid, and these various neurocognitive brain fog. That seems to be a common thread with a lot of these things. Is this sort of brain fog that doesn't seem to go away, and sexual side effects. It actually can affect the DNA. There's studies of DNA that affects DNA.
Wow.
And libido.
Yeah, I don't think I realized it went that deep. So it causes all these, systemic effects for, different people, obviously. I don't think we hear about those types of side effects too often. When I hear about the side effects from Accutane, I typically hear about the psychiatric side effects, depression, maybe anxiety, some brain fog. You don't hear about these other things, though. The Crohn's disease, joint issues. I mean, that's at least from my experience. Why do you think that is?
Well, the only case that Roche actually lost in a trial was related to a bowel disease. I can't remember if it was either irritable bowel or Crohn's disease. There was a documentary that was done about 20 years ago by the Swiss-Italian, public version of public television, which is RAI, right? In Italy they call it Radio Italiano, but in the Swiss part of the Italian part of Switzerland, they have an RAI for their local their TV. But they did this documentary, and one of the patients in the documentary had a irritable bowel syndrome. It's very disabling, from Accutane. And then they interviewed someone whose son had committed suicide while they were taking it. So it's those are all out there. I don't think that the press in the U.S. has really covered it adequately at all. There is a story by a reporter, Kevin McCoy, in USA Today 20 years ago.
Okay.
And then I even had someone who was writing a dissertation for a PhD in journalism about why the press didn't cover the Accutane story. And then she kind of went underground, So she was interviewing me a bunch of times, and then she just sort of dropped off the map. So I don't know what happened to her, but I think so I asked her, well, why do you think it hasn't been covered? And she said she just thought that the company had done kind of a good job of kind of convincing the dermatologists, at least, that there was nothing there. And then that had sort of been passed on to the patient. But,
Yeah, I don't think patients are adequately informed, especially based on the ones I've talked to. There's still a lot of gaps here, obviously. One thing I wanted to ask you, how was your work received at the time? Did you encounter any pushback from colleagues, industry, or regulators?
Well, I think initially at least the company at least thought like we wouldn't finish the study, because this was something that, the way it started out is I've been doing NIH funded research, and I said, this is something that's sort of novel. I don't think the NIH is going to fund something like this. This is sort of out of the blue. But you could do it with donated funding, which is where the donations came in. I think that, I myself was skeptical even before we did the study that there was something there. I mean, obviously my attitude has changed a lot, but I would probably, before we did this research, I was not like a advocate for patient safety or anything related to pharmacology. And I was just probably have the typical attitude, the skepticism, and I was pretty skeptical about the whole thing initially. And then once we did the study, there wasn't really a lot of support. It was sort of seen as sort of something where, maybe it's like, some of the other medical colleagues are sort of like, well, we get a lot of money for the stuff we do from the pharmaceutical industry, and, why are you rocking the boat? Or, the university was kind of like you know, we don't want to have this have a negative impact on our image, and we're, you know, and they actually tried to stop me from testifying in some of the trials and stuff like that. So they were not
really.
I wouldn't say they were very supportive at all. The FDA, you know, I'd say the FDA was mixed. So I at one point I was trying to arrange a multi-site study, like a clinical trial, and I had a meeting with the FDA who they basically said, like, we can't do it. I said, well, can you tell the company to provide us the medication? Because the medication costs like $20,000 for a course of treatment. And they said, you know, we can't force them to give you medication. And the company was not cooperating at all. And so I thought, and they said, we have to take them to court, and we don't have the funding to take them to court. And, you know, I said, well, can you help in the research other ways? And they just say, we don't have the funding for that. So it was sort of, that was not very helpful. Although a couple of the FDA people who did some of this kind of reviews of the literature of the FDA reporting database did write a couple of articles. So I would say that there's maybe 2 people at the FDA who were on board and were, you know, did something that was helpful, but kind of overall, the overall agency, you know, was not. I mean, a lot of that was driven at the time by the suicide of a congressman who was holding hearings. But he kind of got targeted as the enemy by the manufacturer, you know. So it's, even if you're a congressman, it seems like they don't, you know, they're not afraid to go after you. But and that led to some hearings in an FDA kind of weekend conference where a lot of the 37 re-challenge cases were, you know, put together as part of the presentation and whatnot. But then once it, you know, went on the label, then the company took the drug off the market in 2009 after their patent ran out. And they said it was because of marketing or business purpose reasons. But then the generics came in and they prescribed, the actual prescription of it just continued up until the current time.
So they temporarily took it off back in 2009?
Well, Roche took Accutane off the market in 2009.
Okay.
But there were these generic manufacturers that stepped in. And so I reviewed the FDA reporting, adverse event reporting system, and the number of psychiatric side effects has been unchanged, basically.
Has it gone up at all? I mean, or has it just been kind of steady?
Well, there's probably more, maybe like 20% more since 2009 than before 2009. Yeah. But, you know, it was prescribed a lot more before 2009. It was $1 billion a year drug. And so the prescribing was probably 5 or 10% of what it used to be, although the awareness increased, so there's probably more reporting. But my guess is that the actual number of psychiatric side effects per prescription is, you know, probably not changed, but it hasn't gone down. That's for sure.
Yeah, absolutely. When did the drug come out? Was it in the 70s?
1983.
1983. Okay.
Yeah. So they brought it on the market in 1983. Another thing that people don't know is that, like, there is a New York Times article about microdosing of Accutane, like maybe you could get away with smaller doses. I know the guy that invented the drug, and he patented the lower dose. So the recommended dose is actually probably a lot higher than you need. Okay. But that's just because they have a patent on the higher dose. So, but it came out in 1983, and then some of the generics started coming on the market, like in about 2006, I think.
Yeah. Okay. And so when did you hit the scene to actually start studying this and speaking out about it?
Well, I was contacted first, like about 1999, and then we didn't start the study until I moved in 2000 to Emory, which is in Atlanta. And we published the study in 2005. Okay. And that's about when the results came out, that's when all the litigation sort of took off. And so then the litigation went on for a couple of years in the U.S. Before they settled. And so they settled in the U.S. I don't know exactly when. It must have been about 2007. And then in Ireland at the same time, that case settled in Ireland.
Okay. Just so I understand the study too. So you use a PET scan to assess essentially the brain of post-Accutane syndrome sufferers. Is that correct?
Well, we didn't. It was in. We just recruited people that had never been treated before.
Okay.
We said we can give you free Accutane for 3 months.
Oh, okay, I got you.
Yeah, and then we had some other people that were going to get antibiotics.
Okay.
And so we just compared the two groups for 3 months. You got a brain scan at their baseline, and then we followed them for 3 months. And at least a couple of the people became acute. At least one person became, genuinely depressed.
Really?
Yeah, and then we, at the end of the 3 months, we scanned them again, and then we looked at brain function using a radioactive form of glucose. The brain uses sugar or glucose as its fuel. And so if you get an increase or decrease, that's showing changes in function in specific areas.
Okay, that makes sense. Were there any particular stories from your patients that you heard that kind of stuck with you in terms of side effects?
Well, this one particular patient in this study, she was like very tearful and everything, but I've heard other, people have emailed me, when things go wrong. I had one family that they emailed me and said that their son was, psychotic. He thought he heard Jim Morrison talking to him from the head of a monkey and telling them to kill himself on, June 19th, 2005 or whatever. Mm-hmm. So they came down to meet with me, brought their son down to meet with me in Atlanta. I told them, well, on June 4th, the day before, just make sure to check him in a psychiatric hospital, which they did.
Right.
And then he got off Accutane. I think he got better after that. I've heard other stories of people, lighting themselves on fire and jumping off a bridge. And, just some of the behaviors are just really wild. They're not just suicidal gestures. They're sort of, and then there's you can read about it in the Washington Post. There's a kid who was just driving, through the mountains in Virginia. Yeah. And he drove right off the road, crashed in a ravine. And then he got out of the car and just started walking in a straight line, even regardless of whether there was a ravine or a hill or whatever. Mm-hmm. He just kept walking in a perfectly straight line for another 2 miles until he died.
That was up in Shenandoah, I think.
Yeah.
If I remember correctly. Yeah, I heard about that. That's wild.
And they have an Instagram page, kind of like in honor of this kid.
I think somebody shared that with me recently. Yeah, I think I've looked into that. It's incredible. All these effects from this drug. I mean, you don't hear about these things either, which is wild. I mean, the only time you hear these stories are when you're in these communities, post-Accutane syndrome communities, and they all share their stories, but you don't hear about this in the mainstream media, which that really blows my mind.
Yeah, I don't know, like that's sort of a mystery. I think part of it is, like one factor is this sort of this success, what I would call a successful propaganda campaign. Mm-hmm. And the propaganda campaign has going for it that, you can say, well, this is a drug for baldness. Why would it make you suicidal? Or this is a drug for asthma. Why would it, this is a drug for acne. And so it kind of goes against the logic of the average person. Or in the cases like the homicide case, where they say, well, oh, he's going to use this as an excuse for this evil deed that he did, so that's sort of the way that the mind works. But, why like major news organizations like the New York Times has never covered any of these, I don't think. I mean, they never covered Accutane. I don't think that they've covered Singular, so, and you're right. So you go into the online forums and then you see the people that are affected and communicating with each other. But, I know in Europe, like they have Accutane, societies, if you will, that are now, and this has sort of grown over time, but they're communicating with each other from like Germany, France, Spain, the UK, and then once
one of those groups actually.
Yeah. With this film, they've sort of, looked at it as a kind of like a banner of the struggle or something. But I mean, it was, my motivation was really like, like you said, after a while, it's like pointless to have debates with people anymore. Yeah. Because it's just like, so it was sort of, I thought it was more important to kind of, tell it more in a story form so people could see like what actually happens when you have this conflict between a major side effect and then the manufacturer, and then kind of all the forces that are playing against it,
Yeah, I think there's something to be said too. There's a lot of people on these different forums, whether it's for finasteride or SSRIs or Accutane. And I think it's very easy to overlook those forums, right? They're just anonymous people talking about their stories. And with this channel here, Moral Medicine, we've had multiple, probably at this point, 60 to 70 interviews of people who have been damaged by, again, finasteride, SSRIs, or Accutane, speak up and tell their stories. And the channel is really gaining a lot of popularity because you're actually putting a face to the suffering. It's no longer you're just reading a forum about somebody who, they had suicidality or they had this happen to them or that. You're actually seeing somebody talk, face to face on the screen, telling their story. So I think we've seen a lot of momentum build in terms of awareness because of things like that, which I think is great. I want to see more people speak up and talk about these things because they kind of just get brushed under the rug at this point,
Yeah. So, kind of the idea of, having patients be more kind of have more self-advocacy is, at Emory, there was a international conference on medical volunteering, where, people in the medical field that were going to Africa to do surgery for cleft palate on their vacations or, doing different things like that would come into this conference and they present what they're doing. And it's sort of more of a patient advocacy forum. And that was sort of started by a friend of mine, Neil Schulman, who's a physician. And he was friends with this Patch Adams, which was, the original movie was made that had Robin Williams in it. And he's another, he's been involved in this film and I know him. And he's another person who has been a real advocate for, for patient advocate, for kind of standing up for people who are, having issues with medication side effects or, kind of advocating for people that are getting burned by, whatever injustices there are in the American medical system or whatever.
Right.
So that was sort of the kind of the impetus behind a lot of the stuff that we do. But that was the impetus behind some of the books that I wrote and whatnot. But it is sort of an uphill struggle in that, it's easy to dismiss people that are writing anonymously. But then, why do, I was just looking briefly at this finasteride, and there's this sort of, physicians writing, they say it's nocebo.
Man, that is the number one thing I hear from physicians. This is the nocebo effect. I can't stand that. I can't stand it. The thing is, the vast majority of my symptoms actually developed after I quit finasteride. That's what's kind of unique to finasteride, which is really wild. But I'd say about 95% of my symptoms started after I quit the medication. I dropped 20 pounds in 6 weeks after I came off the drug. I developed lipoatrophy, loose skin. My face started to change, muscle loss, higher pitched voice, Peyronie's disease. I got diagnosed with Peyronie's disease after I came off the medication. They don't want to acknowledge these things. And so, what do patients turn to from there? They have to be advocates for themselves, unfortunately. And to be honest with you, sir, I think it's disgusting that so many patients have to go public and share their stories like this so openly, but it's working. It's making a difference, but nobody should have to sacrifice their privacy just to get doctors to listen to what they're going through. It's a really unfortunate situation.
Yeah. And then when you sacrifice your privacy, then you risk people making snide comments about your disease, or, and compounding the trauma and making it worse.
Yes. Yeah. I was actually in the Wall Street Journal about this back in March, and then the New York Post picked it up, and then the Daily Mail, which I didn't expect. So you can Google my name at this point. I'm pretty much all over the internet about my issues with finasteride. At some point for me, you kind of become desensitized to it. Because all you care about is just getting better and trying to build momentum for this movement. So hopefully at some point there's going to be some viable research and, ideally a treatment for these issues. So time will tell. One thing I wanted to ask you too. So in your book, The Goose That Laid the Golden Egg, which has been made into a movie, You not only shared the science, but also the broader story of how Accutane's risks were handled by pharma and regulators. What do you think that story reveals about the way our system treats inconvenient truths about drug safety?
Well, I think there's there's like sort of multiple factors that are kind of working together, and that it wasn't really appreciated maybe 20 years ago. I mean, more recently, there's been more of a kind of a publicity about, the fact that the pharmaceutical industry is paying for a lot of the education of physicians and medical personnel. And there's sort of a mutually beneficial relationship between, especially like there's the pharmaceutical companies will identify what they call the leaders in the field, or they call them KOLs, or key opinion leader. And there's even, in the past, there were companies that they could hire as consultants to find out who's the key opinion leader in this particular area. And then they get them on board by, giving them a lucrative job as on an advisory board, or paying them to give lectures, which the lectures are going to be, often they may be a lecture about how do you treat acne, but then there's sort of a message in there about, Accutane is a great drug that is safe or whatever. And they've learned that the way that doctors become educated, they don't go out and read a book on their own. They were trained in medical school by these researchers, people like myself who are in a medical school, that's their job. And then when they come back for retraining, once they're out in practice, they go to these medical conferences and they go listen to the guy who is their attending in the medical school who's doing research. And then they get this lecture, but then they've been, supported financially by the drug company. So it sort of creates this channel of information that's very hard to push against. So if you had one person like myself, kind of going against this information channel, it can be very difficult, So like, I heard recently that someone who knew, like someone who worked within the company that makes Accutane, 20 years ago, they said, "Oh, this Bremner guy's giving us a lot of trouble." I thought, good grief. I was like one person going against this $1 trillion company. I mean, I didn't have a chance, that's crazy.
Right. Yeah.
And then when the major news outlets are not covering the stories, I mean, it's apparent that some of these issues are not getting the publicity that they deserve.
They're not. Dr. Bremner, I want to first say, I mean, I appreciate you standing your ground with all this, because that's not easy, obviously, to go against the grain there when you have, all this pressure from the pharmaceutical companies, colleagues, essentially, probably trying to suppress your voice, if I had to guess. So I commend you for doing that. And yeah, there isn't, I guess for me, as somebody who suffers with PFS, post-finasteride syndrome, I'm just amazed that there is so little coverage with all this, because I interview people, again, who have been damaged by SSRIs and Accutane too. And it just seems like these drugs have been on the market for 30, 40 years. You said Accutane's been around since, I think, 1983.
Yeah.
And it's still being prescribed to people. And in my opinion, they're still not getting true informed consent, and people continue to get damaged by this. I guess my question is, at what point do you think the bubble's gonna burst and they're actually going to officially recognize these post-drug syndromes?
Well, I think that so I've been following this now for, I guess, 25 years, and I do see a change in that I think that with the change has been with social media. Social media didn't really exist 20 years ago. Right. And I remember when I created the first website for our research program, and it was like a novel thing, and I remember seeing the first internet web pages and stuff. So, there's downsides to social media, but I would point to this as one of the positive things of social media, and that these Definitely. Groups that have 18,000 people. I mean, I've only really sort of kind of seen all these different groups over the past couple of years. They didn't really exist before. And I was actually just thinking about that today, like what's different now than 20 years ago. 20 years ago, there was this sort of coalescence around some of these legal cases, and you had a group of, hundreds of lawyers and their clients who were pushing these legal cases. And then it had some awareness based on the legal battles. But once they started doing summary judgments against them in the United States, it fell off the radar. But then it came up on the radar in the UK, where they actually are writing about it in papers like The Guardian. You know, they'll writing about it there. And then there was a documentary in Australia. But this documentary that's on YouTube now, it's called Skin to Die For. I just put subtitles on that 2 years ago. Before it was only in Italian with no subtitles and no English translation. But it's a great documentary. But I think that it came out of Switzerland, which is where the company came from. I think that something happened where it was suppressed, probably by the company, I would guess.
That's really interesting. I do wonder how many I don't know, inner workings there are to suppress this information. It seems like the more I dig into it, I try to stay away from the whole, conspiracy theorist realm, but it does seem like there is a lot of corruption within, the regulatory bodies. I don't know. It's a really wild situation.
Well, one problem is like with the FDA is that they finish their term at the FDA and then they go immediately into working for a pharmaceutical company. So it's sort of like they don't want to burn their bridges, and they're going to make, twice as much money with the drug company.
Yeah, that would make sense. We recently had on the channel, I don't know if you're familiar with him, Dr. Joseph Witt-During. Does that ring any bells for you?
No.
He's a former FDA, I believe, officer was his title. And he's essentially speaking out now about some of the corruption and the conflicts of interest within the FDA. He left it years ago, and now he has his own YouTube channel called Taper Clinic. And he interviews people kind of like I do, patients who have been damaged by SSRIs or finasteride or even Accutane as well. You should check out the channel. It's really cool. But he does talk about, sort of the corruption within the FDA and those conflicts of interest. So I'm glad to hear, some of that information is getting out more to the general public.
Well, one of the previous FDA directors was married to the chief counsel for a major device maker.
Oh, really?
Yeah, and then was not really recusing himself from some of those cases. But I think that with some of these self-organizing patient advocacy groups can be very effective.
Mm-hmm. Yeah. I think they're making a change. Actually, I want to go off that last point we just made here about the FDA. If you could change one thing about how the FDA regulators handle drug safety today, what would it be?
Well, I mean, one thing is to eliminate any conflict of interest. I think there were some, like I was talking about with one of the former directors being married to someone who was an attorney. I think there should be some mechanism to prevent this sort of lateral moves from, the federal agency to the persons that they're regulating, because I think that is a conflict of interest, that even if once they move to the pharmaceutical company, they're no longer affiliated with the FDA, I think that it could influence, some of the decisions that are made before the move. The other thing is that, there's a lot of emphasis on getting rapid drug approval, but they don't have, because the people are putting up, and this has happened with the HIV drug era, they said we need to get these drugs out faster. So they moved a lot of resources towards the approval process, and they didn't have enough resources for the surveillance once the drug comes out on the market. So what happens with all these drugs is they're going to do a trial with 200 people, and 200 people is not enough to see these side effects that are not common, but not necessarily totally rare either. So, with 200 people, you can't see, a signal for depression or suicide come out right away. It's only when you get out there and it's being given to thousands or tens of thousands of people that you start to see, these problems come up. And so they don't have enough personnel to monitor the post approval process is what they would call it.
Right. Yeah. How big are the sample groups for the clinical trials typically? Is it around 200 people?
Yeah, I mean, like the SSRI trial might have a total of 400 or 500 people. Even that is not enough to. And then they may ask you to do a couple of different clinical trials, but those are not. I mean, and you see it again and again. I mean, you could look at like Vioxx and heart disease, or
Vioxx is a big one.
Yeah. Right, and so it wasn't until, in fact, I think that the heart disease risk started coming out when they were trying to get approval for some secondary indications. So it's not with the initial clinical trials that you see these signals. And so, and these things are a big deal. They need to be addressed. So people need to be more aware of the fact that there should be the FDA should have more resources maybe to do surveillance after a drug comes on the market. Yeah, absolutely. I don't think patients report their symptoms enough either. I mean, what are your thoughts on that? So there's this FDA adverse events reporting system, the FAERS. I actually went through and counted up psychiatric side effects reported for Accutane, and there's over 400 completed suicides, just in the past 15 years. So that's an illustration of how. But I think I may have been the first person to, at least in the last few years, to go back and actually look at the reported side effects. But it's right there on a publicly available database on the internet, and I compare that to minocycline, which is prescribed just as often for acne, but it's an antibiotic, and there was tenfold more completed suicides than with Accutane and its generics like Absorica, one of them, as there was for minocycline. Oh man, that's tragic. Last question here, doctor. So finally, moral medicine exists to amplify patients' voices and highlight stories the medical systems often ignore. What message would you want to leave with our audience, patients, families, and clinicians about listening to those voices and pushing for real accountability? I would say that you should be, particularly with some of these medications, if a family member is thinking about taking them or going on them, you should be extremely careful and do your own due diligence and research, because once some of these terrible side effects happen, it's potentially not reversible, or completed suicide is certainly not reversible. And if something like that happens, it's just it's a tragedy for the individual and for the whole family. So if going out to read some of the testimonies of some of these forums that are available on social media, before you get into one of these medications, it would be a good idea, because these are potentially dangerous medications, and often they're given for things that, in retrospect, like a pimple that's not going to lead to scarring acne, you could have just waited until you kind of grew out of that situation, or you could have used other treatments, like a, tretinoin cream would be preferable. And then in the case of the male baldness, I mean, is that worth the risk? Is it to have like a severe effect, like a effect on libido or sexual function, for the sake of avoiding baldness? Yep, I would agree. Yeah, I think people just need to be given that true informed consent to make that decision themselves if they want to potentially take that risk. I think, honestly, doctor, those are all my questions there. Again, I don't want to take up any more of your time. I really appreciate you doing this. Sure. I'm trying to get as many clinicians on this channel as possible. It really helps, build our credibility. This is a very grassroots sort of YouTube channel here. I've been building it myself for the past 2.5 years. We're gaining a lot of traction, but having your voice on here really helps with our credibility. So I really appreciate you doing this. Sure. Yeah, absolutely.